And the daily tally of new cases not letting up, 6,008 new cases over the past 24 hours. And we've also lost 42 more Michigan lives over the past day to COVID. Each day, we seem to be watching that number of new cases rise steadily. Here's proof. 1 week ago, there were 4,100 new cases.
And as cases rise, we're seeing testing centers get a whole lot more busy as well. Let's check out this line at an urgent care on Ann Arbor Road near Hagerty and Plymouth. All of those people are there to get tested. We want to get to Dr. Frank McGeorge. This second wave, Doc, is starting to look a whole lot like the first one.
Yeah, Kim and Devin, it is. But there are some differences. The biggest difference between April and now is that back then we were reacting to spread that had unknowingly already occurred. This time we have a good idea of what's coming and we know how we can slow it down. The numbers are clearly worsening, but we aren't where we were in the spring, at least not yet.
Looking at the case numbers for the entire state of Michigan, the increase is dramatic. The 7-day average of cases was 5,040 on November 10th. That's compared to 1,020 just a month earlier on October 10th. Since the spring, we've significantly increased our testing capacity, and more younger people have been testing positive. Because both of those have an impact on the way we interpret the number of cases, other trends can be more helpful. On November 9th, the percent of tests that were positive was 14%. This is significantly higher than a month ago when it was in the 3 to 4% range. This change shows that increasing case numbers are due to more spread, not more testing. Looking at the trends in both hospitalization and intensive care unit cases is a very helpful gauge for both the severity the state is experiencing and the strain that's being placed on the healthcare system. Statewide, on November 10th, there were 2,936 hospitalized COVID-19 patients and 595 in an ICU. That's also up from a month ago when there were only 928 hospitalized and 218 in critical care. Now, a final piece of the puzzle in the numbers is a change in where cases are occurring. In the spring, our area was the state's epicenter for COVID-19. Back on April 20th, 83% of hospitalized COVID patients were in southeast Michigan. Currently, only 43% are here, meaning there is still time to act before the system is overwhelmed.
Now, the bottom line is that specifically from the standpoint of severe COVID cases, things are clearly getting worse across the state and in our region. In fact, in southeast Michigan, the number of hospitalized adults with COVID-19 has tripled in the past month. Clearly, what we are doing right now is not enough. That is an unsustainable surge, and we will find ourselves right back where we were in the spring, or frankly, even worse without any action.
And Frank, you say, or even worse. We know how bad it was. What do you mean when you say even worse?
Well, look at this. So we are just at the start of winter. We are heading into the holidays with a high baseline. And on top of that, remember, back in the spring when the rest of the state and even the country was doing better than us, we could call for help. Now everyone is in the same boat or worse. There is no capacity for help here. And that's why I feel this is an opportunity for me to say something that might make a difference. This is all hands on deck. It's not a heavy lift. We're talking masks, distance, hand washing, simple stuff. But frankly, everyone needs to help.
Yeah. Okay, Dr. McGeorge, we appreciate it.